Thank you all for joining us today. This is Association for Experiential, our COVID-19 webinar series. The association is helping people out, hopefully during this time with these webinars. All our webinars have been recorded for this series and are available at our website, www.aee.org. We also have a resource library on there to help folks with questions and information, kind of a gathering point for that. So again, those are all available on our website. My name is Sherry Bagley. I'm the Executive Director of the Association for Experiential Education. And today we are very, very lucky to have two experienced speakers, and they are going to walk us through some of the risk management, legal, and practical issues while navigating during this time. Steve, do you want to go to the next slide and we'll talk about our legal notice? So we just wanted to make sure that everybody was aware we're offering general information only during this time and not providing specific legal, medical, or risk management advice. There are a lot of people to consult with for those things, your local health authorities and your legal counsel, your insurance agents, people who have specific information toward your unique business. Cathy and Steve are also offering their help and their support up, and their contact information will be available at the end of this webinar. It's also available on the registration, and we'll have this recording and any pertinent information like these slides available too. So thank you very much. A few Zoom webinar guidelines for you all. I know lots of us have been on many Zoom things at this point, meetings and things like that, but for our webinar, just some things: everyone except the panelist is muted and your camera is off. We are recording, so this will be made available and be emailed to all of our attendees today, and also available at our website, www.aee.org. If you have questions during the presentation, you can chat in the chat box and we will try to answer them. You can also chat in the Q&A. There's a place to put in questions for that, and we will have some time at the end for questions specific to your programs or just things that need some more information. At the end of this, there'll be an evaluation that is sent to you, and it's a very short one, and it just gives some feedback for our presenters today and some feedback for AEE. We're continuing to provide these webinars, and if you have needs or thoughts or wants, please let me know or email our website. But we are looking for more webinars to help everyone out during this time of crisis. So these are our presenters today. Steve has been a longtime friend and member of AEE. He started his own experiential consulting LLC, and he is on the Wilderness Risk Management Council and has been has opened himself up for webinars and for doing this webinar with his good friend Cathy and Steve. And Cathy is an attorney in Colorado. She works in recreational, adventure, and experiential law, and they are here today to provide us with some information and hopefully answer some questions for you. Thank you, Steve and Cathy, so much for being here. We can't tell you how much we appreciate your time and your expertise during this.
It's great to be here. Thank you for hosting us today, AE.
And thank you to AEE, and also thank you to Steve. It's a privilege to present with Steve today. And our hope is that this will give you a bit of a balanced approach on some of the issues that both of us have been seeing and experiencing as we watch and work with some of you. And so our goals today, we just have an hour and we could probably take a day, but our hope here is really three general things. We'd like to address, risk management, legal, and practical issues, and really sort of provide you with some points on the map, so to speak, of what we think are helpful areas to be thinking about as you proceed in this very uncertain and fluid situation. The other thing we'd like to throw in as best we can are just providing some examples of what we've been seeing out there as this thing started, and this whole, what I've been calling a milieu, I like that word, of just issues that continue to change and create different circumstances on a continuing basis. Thirdly, we'd like to discuss really the important element of adaptation for the present and for the future, as we all continue to navigate this, and navigate it both as organizations, and for Steve and I and other professionals out there, navigate it as those people that are helping you. So that's what I've got to say there. So I guess we can proceed forward.
Cathy, I'm going to jump in here and give you the results of our poll.
Okay.
So we have a good sense of who's here. And it looks like for the first question, what type of programs does your organization run? 34% of our participants today are in the adventure programming, 8% in outdoor behavioral health, 5% in conservation, 11% in camp, 28% in school, and 14% in other. And I know a couple people have chatted that includes like gap year programs and things like that. So looks like adventure is 34%. What is the current status of your organization as a result of the COVID-19 pandemic? 57% of those attending, their program is not running, or it's on pause today. So over half of them are on pause. Currently running is only 17%, and partially running 26%. And then the question about whether or not operating programs in the United States, 72% are in the United States. 21% are in both the US and international locations, and 7% only in international locations. So hopefully that'll give us a little more informed information about who's with us today. And I'll give it over to you, Steve. Thanks so much.
Great.
Thank you very much. Yeah, so we've talked a lot. I really had to think about how to start this out, because if any of you have seen me speak at the Wilderness Risk Managers Conference or at the ACA or any of those, I typically start out what I say, that the point of sort of the goal in my presenting and what I share with all of you is the goal to run a quality program. And that goal, I feel, is super important because it addresses legal, risk management, and practical issues, all of which are interrelated. But in this situation, I wanted to sort of set the stage. So typically at a conference or in working with some of you, we talk about managing the risk of loss to the participant and to your organization, because you have effects from both. And so a typical risk to a participant in your programming might be rockfall or whitewater. And the result for them may be that they get injured. A typical risk for an organization might be a tax issue or a data breach or a permit, loss of a permit in national parks or something like that. In each of those, the organization, in the case of a permit, for example, the organization would be affected, and it would affect the participants because they would have fewer programs that could be run. If a participant was injured, it might affect the organization if the participant sued the organization. In all of those cases, there might be financial risk or reputational risk of loss, things that could happen. And those are some typical things we might be talking about. And the reason we like to look at the risk of loss to the organization and to the participant is because it's a proactive way of looking at this, to run a quality program and examine these things. But this is really a horse of a different color, what we're seeing right now. I think what I think is something that I thought about was instead of one thing happening to one person or even to a group of people, you have both faucets going off. The organization is shutting down and the participants have nowhere to go. If you've shut down your programs, you have two situations. You're managing these risks of loss, but both are shut. The curtain has gone dark and you're wondering, where do I go from here? So you're talking about running a quality program, but where's the program? And so, you know, from my perspective, I think that's why we're here. I think ultimately the key to this is, what is your essence? Running a quality program that is in line with your mission is super important. And now it's even more important. And what can come from that is that you're looking at the communication and the information exchange that you have with all of your affinity groups or stakeholders or whatever you want to call them. In large part, you've got your participants. And without a program to run right now, or even if you're running, you can still remain relevant. You can still look at your future. You can still have the opportunity to communicate with the people that matter to you and sit in this position and to plan for the future. And that's really what we wanted to talk about right now. And the last thing I want to say is that when we think about information exchange and communication with your groups, you're not just talking about the groups that are outside of your organization. That is the participants, the families, you know, the organizations you need to be in touch with, your funders, but also your internally, your staff, your people, and how are they feeling, what are they doing, and where they are. And those are some of the things we're going to be focusing on today. The last thing I wanted to say, when the lights go out and you're not running, it feels like you're all alone. But first of all, we have a lot of people on the call. But secondly, I think to stress this, you're not alone. This is affecting everyone in the chain, not just your organization. It's affecting the participants. It's affecting the people that you have agreements with that are running programs, perhaps vendors or third-party providers, suppliers in countries or in the US, and communities that you're working with and where your participants will go. Those are all people in this chain that are affected, that are part of the people that you're communicating with. And that is an important key as we go forward. Go ahead, Steve.
Thanks for that great introduction, Cathy. It's such a pleasure to be doing this with you because we have such a shared philosophy around the intersections between risk management, the legal considerations, and the real goal of running a quality program. So I really appreciate that introduction. I'd also like to highlight something else that you mentioned, which is that you are not alone. AEE has been doing a tremendous job of creating forums like this to bring people together. And I think that's really important when some of us may be feeling a little too socially distanced right now, and that there is a lot of collaborative learning and just mental health that can come from connections like this. So appreciate that so much. And also just want to welcome all of you to this talk and to say that I hope that your personal health and well-being is intact, even as some of our programs may be struggling right now. There's also a lot of programs that are actually still running and open and in the field, and essential services, therapy programs, maybe conservation corps that are working in farms or emergency response capacities and things like that. So there's actually, while we're kind of focusing on, for some of you, how to reopen your programs, I believe everything Cathy and I are going to share today are also relevant for programs that are currently running or kind of in a partial state. Some might be hibernating, trying to get ready to come back again. So we're going to try to present to this very broad audience, concepts that hopefully you'll be able to pick and choose the ones that are most useful for you. So risk management, what are the risks that we're really talking about here? We are really talking about risks to participants, to their families, to your staff, your organization itself, and the communities where you operate. And examples of some of these kinds of risks might be the obvious medical risks of COVID-19, but mental health as well, legal issues, financial issues is a big one that a lot of you are probably feeling right now, and the reputation risks of if you continue to run or when you decide to reopen, what are the reputation risks that come along with that, and based on your ability to run that quality program that Cathy mentioned. some specific examples about medical risks that I want to mention. The obvious ones to your participants and to the staff, but also to the communities where you operate. And, we've seen a lot of articles and sort of pushback from small gateway communities where wilderness programs operate that don't have the capacity to absorb, large influxes of visitors right now. And, that's definitely something to be mindful about, not assuming that that all of the normal medical resources that would be available are going to be there for your program, and the impact that you can have on your community's medical capacity, things like that. Even a minor injury that you have to go to a hospital to get treatment for could expose you to COVID-19 in a way that is enlarging the risk of that minor injury that you had. So those are just some examples of the changing landscape around medical risks right now. Legal risks, if you failed, and Cathy's going to talk a lot more about this, but the legal risk if you fail to operate within your own protocols or within what would be reasonable protocols or newly established protocols that you've just put into place. I would really caution folks against blindly borrowing other protocols from other organizations. It's important to be collaborative and to learn from each other, but not to pick up something that another organization is doing and just drop it wholesale into your program. It wasn't, that protocol may not have been built for you. And that other organization may have very different resources and environment that they operate in. And they may be operating with a whole team of medical evaluators and a physician advisor. And they may have the capacity to do things in their program that you don't. So while it's important to learn from each other, you can incur a legal and a practical risk if you are blindly adopting, practices and protocols from other organizations and dropping them into your program. Reputation risk is an interesting one. Been working with some programs around the country, service learning programs that are international, and stories about how normally they're quite welcomed into these small communities where they work. But right now, given the environment and climate that we have and fear around COVID-19, a lot of these programs are reporting that they're not as welcome. They don't feel as welcome going into these small communities or international travel and all that. So just be aware of the reputation and the relationships that you have with your vendors, with your community, with the areas where you operate. Financial risks are really quite obvious. And then, the risk that if you close your doors, will you be able to reopen? And I know a lot of organizations are really struggling with that one right now. It's been a tough week for a lot of large national organizations that have had to have major layoffs and furloughs, and a lot of the organizations I've worked with over the years that are having a very tough time right now. So this slide is about some heavy stuff, and I'm sorry that we're starting on a heavy note like that, but hopefully as we keep moving through the content, there'll be some more helpful things and useful practical tools for you. And back to you, Cathy.
Well, thanks, Steve. I think those are really good points. And one thing I do want to emphasize, I mean, certainly I would agree with and resonate with Steve about the legal issues, and there are many as we walk through the different phases of COVID. And what I like to say, and I don't mean it as in a negative way, but in a realistic way. And I take the analogy or the picture in my mind of a sea sponge, which is basically sitting in the water. Water's flowing all through it. And that is your program. And flowing through that program in every way are legal, risk management, practical issues, and your mission all together. And that is going to happen at any stage of this COVID situation or milieu. And one thing I wanted to say, and I know Steve has been doing this too, I was involved, really, I think of it in different phases right now, and we're in a phase, we don't know what is really coming next. But from the beginning, when it was all over in China, and it was not really about what we were doing in the U.S. or really in other countries. And then in mid-January, I wrote a piece for the National Association of Independent Schools, published in the end of January. And that was when some of my international tripping programs were just beginning to see the impact that this was going to happen and affect us. And what I began to see next were things happening within the chain. That is frustration and disappointment and fear from participants and organizations that were my clients or others saying, what do we do? You know, what is the CDC? What is the State Department going to do? How do we decide if are we going to pivot? Are we going to offer credits? Are we going to transfer? Are we going to cancel programs? And then the added issue of if we go into a country, what if there's a quarantine? I had a program that was going to run in, I believe it was Vietnam. Tell me if I'm wrong. It borders China, right, Steve? And I, you know, just before they were thinking about what to do, there was the quarantine in a city on the north border of Vietnam. And then it became, okay, if they do go, will they get out? Will there be medical care there? What if somebody gets COVID? What happens? And so that began the process of programs figuring out how to pivot and what to do and how to be collaborative with those in the chain, because everybody wanted the program to happen, but it was difficult to understand. And then the next thing that happened was really the operation changes, operation looking at, okay, are we going to wholesale cancel programs? What are we going to do? All of a sudden we had the global, was it the State Department or the CDC saying no travel outside the United States? And then of course, people began coming back, colleges and universities bringing people back from year-long or semester-long programs, and everyone making those decisions individually. And then it became the U.S. Can we keep them in the field? And then now we're in this phase where, as we see, a lot of programs are not continuing. A lot of programs are, if they continue, are in a different phase, which Steve will talk about in terms of risk management. And some are just, sitting there. But the question is how to do that. And one of the things I want to say is from the beginning, and I hope you can continue to do this, is to remain in touch with important groups and people. And of course, the first one would be, in addition to your participants and your affinity groups, but the U.S. organizations that matter to you. If you're in the U.S., based in the U.S., local, state, county, obviously federal sources to know what's going on. I even have some clients right now, and some of you may be out there, that are paused and wondering about summer. I know that a few of them are trying to plan and be proactive about what will summer look like if we go, and what is our drop dead date of when we have to decide, regardless of whether someone decides for us. So keeping in touch with those groups is more important than ever right now. Certainly the CDC and the WHO and the State Department as well. And if you're outside of the US, the relevant, contact points for your country. Connected with the industry. I think remaining connected with the industry is very important. As Steve, I think, will point out later, it isn't necessarily the right thing to do just because everyone is doing it, okay? But it is helpful to understand what's happening in the industry. What are the trends? How can I gain perspective and take my head out of the sand, so to speak, out of my own fear and my own organization's fear and angst, to look around and to try to use that to help me think out of the box and more creatively about what I can do. And then, of course, current entities that are critical that you stay in touch with. If you're accredited by AEE or ACA or another organization, if you are licensed or regulated, like, for example, camps that are regulated by the child care or child care licensing in their state. being in touch with them, they may be able to throw you a bone here and there, or give you ideas about what they're thinking, what may be coming down the pipe. So I think those are all important things to do as you move forward. Steve?
Thank you. So I'm going to talk about communication and information exchange. And you may be starting to get the feeling that this webinar is not just about how to disinfect your water bottles and what are the right, questions to ask on your med forms. We're really looking at the larger constellation of things that encompass risk management for your organization and for your individuals in your program. So communication is one of the most important elements of in that constellation. The things you communicate before, during, and after your program, before, during, and after an incident that occurs. How do you shape people's understanding of what it is that they're signing up for? All these are examples of very important elements in your approach to risk management and to running the quality program that Cathy mentioned at the beginning. So I want to start with the idea of your outward facing. What are you saying externally about COVID-19? And if you don't have any sort of statement by this point up on your website or external statement that you've made to your stakeholders, I would really recommend that by this point that you should do that. It is obviously important what you say, but I think it's more tone deaf not to say anything at all right now. People want to know that you're monitoring, that you're acknowledging the situation, that you're making adjustments. If you're running programs in the field right now, I assume you already do have some kind of a acknowledgement statement like that. But if you're thinking about pausing, delaying, or canceling your summer programs, I would highly recommend some kind of statement. That the absence of your statement is going to be a big deal at this stage. At the same time, the tricky part is not to be too specific, not to overpromise, not to lock yourself into some very specific, date or plan of action. We continue to learn so much, just day by day, week by week. And I did some webinars almost a month ago now on COVID-19, and I look back at them and it's like, oh my gosh, how outdated does that feel already? Because we're continuing to just learn so much in the shifting political climate and travel restrictions and the state of the economy. There's so much changing day by day. So while it's important to have some kind of a statement and all that, it's also important not to lock yourself into something that really could change, later today with either the further restrictions happening or restrictions being lifted or changes in how your region or your constituents are doing from a pandemic perspective. So it really is a remarkably fluid time. And so over communicating right now is generally a good approach. I've seen organizations taking very different approaches to what they're communicating. Some are really trying to buy time and stimulate ongoing interest in their programs without committing to running them at this point because they just don't know. So some are basically having approaches that encourage people to sign up, to put down a deposit, and offering, very flexible, like the airlines right now, like offering very flexible, credit or cancellation policies and things like that. I've seen other organizations flip that on its head and say, we are a small nonprofit organization. We are going to struggle economically through COVID-19. As a result, we want to run our summer programs and we want you to enroll your son or daughter on our programs. But if you sign up, we're going to hold a spot for you, and that's not refundable. We will consider that a donation to the organization if for some reason we're unable to run those programs. So they've taken that approach. And I actually think that's a courageous and creative way to manage that. The key that I'm getting at here is to be clear. Be clear with people what it is that you're doing and to have a reason why you're doing that. And that communication, information exchange and to make sure people know what it is that they're signing up for is not just useful in this era of COVID-19, but it's a principle of making sure that there are no surprises. And a lot of risk management issues or even lawsuits, as Cathy can attest, come when people didn't know what they were signing up for. They didn't get what they thought they were getting, and there's some surprise around that. So really want to just emphasize that. The last one I'll mention is this can seem daunting and overwhelming. Oh my gosh, how do I communicate to the whole world what we're doing? And one of the clients I've been working with has done a brilliant job of dividing their stakeholders into different buckets. And there's a bucket of the primary people that they're actively communicating with and actively sending out messages to and interacting with. There's secondary buckets that are more passive. We're going to communicate with this group through social media or through statements on our website, and we'll engage with them if they have questions, but they're not our primary group that we're communicating with. And just truncating your audience like that into those different constituencies has really helped them to target their different audiences and to have a clear message for those different groups. And I think that's been a very useful approach for them. So just some thoughts there around communication and information exchange. And want to just highlight that that is a really important piece of your risk management puzzle right now. Back to you, Cathy.
Yeah, I'm just going to tag on to what you said, Steve. Certainly great points. And this one is really pretty timeless. And if you've heard me speak, I always mention it, I think. But I think in this time of pressure perhaps to want to run programs, and I'm just going to say this, perhaps the temptation is to run them sooner than later, or normalize them in a way that because of the tension around the financial pressure, et cetera. And so the idea of avoid the temptation to assure or guarantee safety or lay out promises that you can't keep. And that, as Steve says, you don't even know what the answer is going to be. Programs that we've seen that have done that, Steve will talk about one that he found was, just backfires on you. It backfires on you because it shows that you can't keep the promises. And I think that in terms of moving forward, whether you're running programs right now, for example, the essential services, the outdoor behavioral therapy, or otherwise perhaps in conservation, just the idea of personal responsibility of the participants or individuals that are engaging and their families if you're working with minors, and eyes wide open at what these risks are. And again, personal responsibility and just being clear on what you can and you can't do, and being honest and transparent about that. Those are some of the programs that I've seen be very successful in their messaging right now, whether they're on pause or whether they're planning to run or are running. Go ahead, Steve.
Thanks so much. Great points, Cathy. So I want to talk a little bit about just the operational day-to-day stuff, whether you're currently running in the field or trying to plan through your strategy for you're hibernating and you're thinking about how can we open again in the summer or in the fall, whatever your situation may be. What I really recommend is that you set some benchmarks and some criteria for what it is that you need to see before you have a green light. And some of those things are actually not in your control. You can't control if there are travel restrictions imposed by your state or federally. You can't control if if the normal ways that students fly from all over the country to come to your program are going to be happening or not. So there's some criteria that you can and some that you can't control. And I want to talk about just some operational things in the office, pre-program, in the field, and emergency response related kinds of topics here. So I'm going to whiz through these, and I bet we'll have some more discussion of them in the Q&A at the end. But from an office perspective, I'm sure many of you have already found this or noticed this, but it is super important that we not have some kind of a setup or policy or structure in your organization that is unintentionally encouraging people to come to work when they are sick. So looking at things like your family medical leave practices and your ability to telecommute and work from home, and what are your practices when people are in the office, and just office etiquette and social distancing in the office. There's a lot of stuff that we can do that can make the essential people that need to physically be in the office allow that to work, and for the people that don't need to be in the office to allow for that to work. So super important piece, the office side of it. Thinking about program now, pre-program, what are some things that we need to adapt for in the COVID-19 world that we're in? And obviously you're going to be thinking through your admissions and your medical screening, or I like to say medical evaluation practices. How are your emergency response protocols going to be adjusted to match the situation that you're in? I've seen organizations puzzling through, for example, if we needed to quarantine someone for 14 days at the front end or the tail end of a program, is that possible? Could we do that? Is there a way for us to make that work? Looking at transportation, if you have students that are coming to your program typically on public transportation, does that make sense right now? Of course, that can start to butt into your organization's equity, inclusion, and diversity goals if you're not allowing people to come on public transportation. But I would also say it doesn't do them or your organization any good. Health has got to take a large consideration in that equation. So looking at transportation, if you're transporting participants during the program, the normal ways of doing that, like loading the van full of people, you can't socially distance in that situation. So what are the adjustments that need to happen there? Can you actually run in that normal way? So those are just some examples of pre-programmed thinking about those elements of transportation, screening, emergency response, stuff like that. In the field, it's really interesting to try to think through what are the things that we can do, and what are the things that are really very difficult to achieve while socially distancing in any reasonable way. Running a climbing gym right now, for example, for me would be a very difficult thing to imagine how to actually keep it appropriately clean and have any level of expectation that we can manage that. I work with clients that run things like sweat lodges and stuff like that, where people are sitting very close together in a very intimate setting, and it is not very easy to imagine how to do some of these activities in a way that appropriately manages the challenges of what's required of us right now from a health perspective. I think these are some just fascinating things to look at. Emergency response. I mentioned, could you do a 14-day quarantine if needed? Do you have adequate PPE to really make sure that you're not just treating the victim, but that you're not making more victims? Elements like that. So there's a lot of challenges in making these adaptations in a COVID-19 situation. And I really do think that I've got other organizations that have staff that cycle through. Students stay in the field, therapy programs and things like that, where students stay in the field and staff every week, a new set will cycle through. And so you've got people coming and going from the field. And how do we educate and make sure that the staff are accurately self-assessing and not introducing COVID into the group environment and stuff like that. So I'm working right now with the Northwest Youth Corps out here in the Pacific Northwest, and they are doing a really spectacular job of planning through some protocols for what would it look like when it's time to go back to work. And they have established some very effective criteria and clear criteria, some of which are in their control and some of which aren't. that are going to be indicators to them that, when these stars align, when these different factors have been met, we will know that we're able to go back to work. And they're doing that under the direction of a physician advisor, and a very rigorous process. That's just an example of what I started this section on, to think through for your program. What are the indicators, the criteria, the boxes that you would want to check to make sure that you have adequate plans in place? And it is not an easy set of stars to align right now. But as I said, we're continuing to learn a lot as we go, and I think it's very important not to lock yourself into anything too specific too far in advance, because we continue to learn. So I'll pause right there. We can discuss some of this stuff more at the end.
So, this is a big topic, and I'm only going to spend a few minutes on it, but it's been a series of phases, really, for programs that in the beginning for me started with trying to figure out how to pivot, how to respond to travelers who were, flights were canceling and trips were canceling. Were we going to provide credits or transfers, or what we're going to do? And an important, and communicating with the vendors that perhaps, or that were providing the program. For example, a school that might be working with a tour operator or a third-party provider. What was really going to be happening? We were looking at the contracts. What do the contracts say? And what are the contracts we're talking about? The agreements could be between the participants and your program, terms and conditions, or perhaps a release of liability, agreements between your organization and a vendor or a third-party provider. And then from there, what are their arrangements with in-country suppliers and with the communities? Where has the money gone? The deposits and the payments that have been made, and what does your contract say? What if the participants cancel, or what if you as an organization choose to cancel the program? And so the contracts are there, and they may be informative. You may have even had what has really been thrown around in the industry and otherwise, a force majeure clause that says in the event of an incident that occurs beyond our control, an act of God or other thing, which would be perhaps a pandemic. Let's start with that. We do not have an obligation to refund your money. And end of sentence. But what if the participants are the ones canceling first? It's kind of a toss-up. And then the ultimate thing is, you care about your participants. If you choose to say, sorry, we're not going to do anything for you, you may not have a following then. These are some of the things that clients wrestle with. And so it brings up again, despite the fact, whatever your contract says or doesn't say, and this came up last week at the roundtable I did with the Educational Travel Consortium. I spoke for them with a couple of other attorneys. Regardless of what your contracts say, this is an opportunity, because as I mentioned earlier, this is a chain. It affects everyone in the chain who wants to participate or doesn't want to, but they're all connected. So it's an opportunity for collaboration and cooperation, and really attempting to spread the burden among everyone in the chain and help them understand. So for example, you have a participant or their family that's very angry at you and says, you've got my money, and what are we going to do? And your organization is saying, well, we don't have your money anymore. That's why we take payments in increments, because as we're taking payments, we have staff organizing your program who are getting paid, and then we have our providers in country who are paying suppliers to set up for the program. It doesn't just all coalesce in one instant. So it's very important to think about that. On the same token, it's an opportunity to look at your contracts and your information and say, boy, I never really read this. And why doesn't it say this? And how could I be clearer with my people, with my clients? Or how could I be clearer with my third-party provider. We just had a handshake. We didn't even have an agreement. I didn't even know what this was supposed to say. These are opportunities to look forward, whether you're stalled, or I should say hibernating right now, or in some of my clients' cases, they're getting ready to operate, and we're going to be able to write some of those contracts. And so what do we want to say? How do we want to relay this down? And I will leave you with this. There is a movie called It's a Wonderful Life, and I can't see your faces. I hope that most of you have seen it. If you haven't, you need to go to the movie and go to this part of the movie if you don't want to watch the whole thing. Jimmy Stewart is headed out finally on his honeymoon to go to these exotic places. He's got $2,000 in his pocket, and they run by the savings and loan, and they see a bank run on the bank. He jumps out of the car, he walks into the savings and loan, and he proceeds to offer during the entire day so many of these things that we've been talking about. He talks about the mission of the savings and loan. He talks about the fact in front of all of these angry, anxious, and really difficult people, I want my money back. I want it all back. My money is in with you. And he says, well, your money, Joyce, isn't with me. It's with Susie and Tom and Joey. It's with all these people. And here's what our mission is. What is it you really need that we can give you that will make you happy? And over the course of his discussion, you see the faces change, and everyone begin to see, this isn't just about my problem. This is happening to everyone. And so if you have angry people that are coming to you saying, I want my money back, and you can say, well, here's our situation. Let's be transparent. I can offer you a credit or a transfer, or we can do this. How can we work together? And all of a sudden you see in these organizations, they're beginning to understand that they can collaborate and they can cooperate. And that is the silver lining that I've been seeing. So I would suggest you think about all of those things. The contracts should be informative and clear, and now we have an opportunity to make them that way. You should understand them, and they should match your rollout on the ground. They should be things you understand and your partners who are contracting with you understand. So work with your legal counsel, think about those things, but know that whatever's in there, you can always pivot. You can always work with it. Steve?
Great Jimmy Stewart story there. Thanks for that. That's wonderful. So cooperation and collaboration. And this one brings me back to, if any of you have attended the Wilderness Risk Management Conference in the past, some years ago, we worked to distill down some of the essential tenets or principles that conference is built on. And one of them is using your participants as links in the chain of safety. They're not there to blindly be managed. Their safety is not there for you to blindly manage. They can be assets. They can be resources. Your participants can help make your program safer. And in the same way, cooperating and collaborating with your larger community and sharing your risk management challenges openly and collaboratively can help you as well. So Cathy alluded to some of these things earlier, but working with your vendors and your third-party providers and the sites where you deliver your programs, and really sharing with them your burdens and your challenges, and seeking out collaborative problem solving around these things is a really good approach. I've been hearing lots of stories from international travel study abroad programs about the in-country organizations that they partner with and vendors that they work with being really flexible and understanding and trying hard to find a way to raise all the ships and to work together through these challenges. So, this is not uniquely your organization's problem to solve. COVID-19 was not your fault, and we're all in this together, kind of grappling through some very difficult times. The economy is going to really struggle. A lot of organizations have massively downsized. Collectively, there's no way you can fix this problem by yourself. And I think collaborating and really being open and honest about what your situation is and what you need, and asking for the flexibility that you need is a great approach. And I'm kind of making a high level 10,000 foot view comment here, but basically, yeah, I would say in the absence of that clarity from you, in the absence of that asking for what you need, people will make up their own narratives, and it's just comes back to the communication piece again. So just want to keep this one nice and short and simple.
Yeah, we've already talked about this, and I know we're approaching the end, but this has been important through all the phases, and particularly now programs that are paused, but also those going forward, is to really carefully examine your financial picture. You know, what is your insurance? We've been seeing a lot of exceptions and exclusions with, for example, with travel insurance, business interruption. We can't get into those details, but it's really important to understand what you have and you don't have, and to maybe take the opportunity then to meet with your insurance broker and figure out what it is you need going forward and what's going to be covered. If you open up your programming, or if you're continuing to offer programming, what is covered, especially in relation to this COVID-19 and the risks associated with it. Look at your financial picture. There's all kinds of opportunities that I'm sure you're all looking at, but certainly on a federal level, on a state level, opportunities for loans, for forgiveness, for maybe even your lender who can pause your payments. I had a client who had just bought a business January 1st, a venture travel business, and she took a very early action, and the woman who sold it to her said, look, I'm not going to make you make payments right now. I want to see this business succeed. So don't worry about it. We'll work with it. There are opportunities to work with those kinds of partners because you want to, number one, you want to hopefully remain viable when and if, and we think it will be when, opens up. And also, you know, what the other thing I think I want to say is if you're moved to try and really, you feel badly about your participants and they're after you, they want their money and this and that, you need to think about what can we do if we want to change what we have said we'll do, if we're going to give more money perhaps than we said we would, or just look at what is going to help you to remain viable, and don't fall into, okay, we'll just do this for you. And then all of a sudden you realize you don't have the money to back up what you said you were going to do. So you really need to be careful about that. And as Steve said, if you're going to remain viable, how can you do that without completely shutting down? Will it be harder to start up and more expensive? You really need to be strategic about, you know, how you scale back. And we know many organizations have been doing this very thoughtfully, and it's important, but and emphasize to do it important. You want to look at all those options. So that was that's a pretty obvious one. Go ahead, Steve.
Great. Some interesting questions in the chat room, by the way. Thanks to everyone. Looking forward to getting to some of those. So this last one here is basically just looking ahead a bit. Whether you're currently open, or many of you are adventure programs in the US who are currently hibernated and thinking about how to reopen. And some things that have kind of emerged throughout the course of this talk today are how rapidly information changes, how fluid it is, how hard it is to lock down on a specific answer at this point. So all that is true. With that in mind, you know, I think being really realistic about the future, I would hope that many of the great organizations that I've worked with through the years are not just tunnel visioned on summer 2020, but are actually asking themselves the bigger question about how can I still be here in 2021? What is it that I need to do to be viable, as Cathy just said, and to still exist in 2021? Summer 2020 is not going to be normal in any kind of way, regardless of what part of the country or the world that you're in. You know, have you thought through questions around, you know, what is our deadline? When are we going to make this decision or, about running our summer programs or not? And asking those larger questions around, you know, being viable into the future. How can you use this opportunity if you are in a hibernating state to develop some capacities and some resilience for the future? What are some things that you've been meaning to work on but never had time in the busy rush of getting ready for the summer, that now is a great time for us to develop that alumni network that we've always said that we wanted and needed, but we never had time to actually build that. So how can you use this as a time to build resilience and capacities for yourselves, even if that's not ramping up for summer 2020? I've also worked with some programs who they've already raised all their money for the year. They're in a very different position than a lot of organizations. And by not running their summer programs, they're actually going to come out ahead in 2020 because they won't be spending the revenue on running those programs. So all of you are in very different situations. And there's no one size fits all answer to this question. I've seen organizations doing a very good job with graduated messaging, kind of just pushing things out week by week as they creep towards summer and trying to leave the door open for themselves, while realistically not assuming that summer 2020 is going to happen in any kind of normal way. A couple principles I'll point out here. One is this concept of normalcy bias. I've got a blog on my website that you can read that talks about this, but normalcy bias is when we fall guilty of normalcy bias when we say, yeah, I know that COVID-19 is a big deal, but it's not going to happen to us. We're going to still run our normal summer program as always. We have to. If we don't run it, then we won't exist as an organization. And you can get locked into this mode of thinking, that's normalizing something that's actually very unprecedented. Another one is mission creep. So when we have revenue stress and the need to, generate revenue and keep going as an organization, that can pull us and tug us into areas that I like to call mission creep, where we've actually gone altogether away from our normal operations. Now maybe we're doing different activities, or working with a different population, we're running programs in areas we've never run them before, and we find ourselves operating outside of our actual mission, outside of our staff's core competencies and abilities, and maybe even outside of your liability waiver and your insurance. So beware of mission creep as you are trying to be adaptive and innovative and think about, what could this year look like for us if it's going to be different than usual. So with that, we can't give very specific targeted advice about what you should do, but I hope that, through this set of topics that we've really given you a constellation of different things to consider: relationships, communication, operations, the legal side, the financial side, all those different pieces. And I think what we are going to do is basically have a little bit of a wrap-up statement here, and then take any questions that people care to answer. I'll just keep going, Cathy, and then turn it over to you for this. So, I would say my wrap-up is that certainly COVID-19 has been an unprecedented thing, and it's been a remarkable thing to witness, and still rapidly evolving. We have a long way to go yet. There's a lot of political pressure around normalizing this and giving good news and saying, oh, we're ready to reopen the economy, and we've gotten through the hard part and stuff like that. And I would say that is day by day, that is not necessarily the case, and that we have a long way to go yet, and that we already have been severely affected economically, societally, medically, organizationally. There's just been a tremendous wave that we're still in the middle of right now. And I really encourage you to think about not just your immediate future, but your long-term future, how to be viable in 2021. And the last point I'll just end on is just a personal note. During this time of quarantine and people working from home and all that, we've talked a lot about social distancing, and I don't think that's the right term. I think what we really should be talking about is physical distancing and staying socially connected. And I think webinars like this and AE and others have really helped to do a great job of helping us stay socially connected. during this really challenging time. And that this is a chance for us to start developing good habits around stuff like this that's going to endure. When COVID-19, the wave has finally crested, and things get back to some semblance of normal or whatever that's going to look like in the future, what are the good habits that we can take from this strange time right now that are going to serve us well as we rebuild and create this new normal, whatever that's going to be? And I believe that we have an opportunity to create as many positive things from this, and innovations, and remembering some of the new habits and the innovations that came from this time that are going to serve us well and make us more resilient, for whatever might come in the future. So I really hope that that's the case, and perhaps a more positive note to end on than it might otherwise be. So Cathy, I'm going to turn it over to you for your wrap up.
Well, thanks, Steve. Those are great words, and really, I'm gonna keep it short. But what I thought about really to end on a higher note than we've perhaps been moving through here is to say that what I see over the 30 years of working, 25 to 30 years in this business, that there is really a character trait that you all have in this industry, and that is resiliency in the face of adversity and uncertainty. Whether it's in the field, whether it's working with challenging students or kids or people, and it's really there. And I see that as a beacon of hope for this industry. I think you all will rally in various different ways, depending on your focus and your mission and who you are, but you all share that common thread, and you know it. And so work with it and use it to the best of your ability as you go forward. Thanks for being on the call. And yeah, we'll open it up for questions. We're a little bit late, but we're happy to stay a few minutes, right, Steve?
Absolutely. Yeah, let's take some questions.
Steve, we had a couple in the question and answer portion throughout, but the first one being, my understanding is that most liability policies exclude pandemic coverage. As we reopen, what liability do we have if a future participant catches COVID-19 from contact at our facility?
Well, that's a really good question. It's very specific, and it's the kind of thing that would be difficult for us to answer because it really would depend on your policy. But I can say, I'm not an insurance expert, but I can certainly work with a lot of insurance companies, and I can give you this. I know that there have been a lot of exclusions and a lot of issues going on with the pandemic in relation to liability insurance policies. I'm also aware that there were some different insurance vehicles out there, different policies. One that an insurance professional told me about was called Travel Protector. There was an additional separate policy that offered some additional protection. Now, those types of policies that might have provided broader coverage may be going away because of what we're going through. And so the question I would ask of your broker would be, or your underwriter is, what do we need to be thinking about? What coverage is available to us? And as you all know, the coverage, your insurance coverage is one very important layer of the onion of protection that you have if something bad happens. Let's say you do run your summer program and one of your staff members is infected and a guest gets sick, and it ends up being clear that was how it happened. There are a lot of elements to figuring that out and preloading the communication and the information, and perhaps even additional agreements that they can sign to be aware of what's going on and what they're voluntarily choosing to go into. And then protections you might get from some of those documents. But if all else fails, you may be, and you're sued, let's say, you've got your insurance that's there. So it's important to understand what you have and what perhaps you could buy in addition to what you have before you move forward, whether it's for summer programming or sometime in the future. I think that's a very important conversation.
And Cathy, kind of along those same lines, we had a question about if additional media waivers are needed using Zoom and video activities at this time.
If what?
If additional media waivers are needed, and Steve, you might be able to answer this one also, but there are FERPA rules out there for children being on social media and things like that. And a lot of our programs are asking participants to join online in Zoom or in chat rooms or Google Hangouts or many different things. But do you know of any additional social media waivers that would be required?
This would be in a school setting, for example?
Mm-hmm. Or in the program was specifically, sorry, scrolling back through the chat, specifically a school program, I believe, service learning program.
Okay. I'm sorry, I don't offhand have the answer to that. Steve, do you have any thoughts on that?
I certainly don't have more of a legal view into that than you do, Cathy. But I think for me, it comes back to your earlier point about a quality program, and that many of the clients that we work with already have these kinds of layers in place, and that simply because they're doing a Zoom meeting doesn't change the structures that they already have and the agreements and what the parents have agreed to do with their participants and all that kind of stuff. So it may be it may also have very different state by state answers. So I think it's a great question. We can't answer it, but it's a really good one to bring to your local attorney or your organizational leadership to kind of figure out if that's a fundamentally new thing that you're doing.
Absolutely. I agree with that. I mean, if you want to contact me later, I can get a better understanding of that question, but I definitely think you should be working with your legal counsel if you have a question about something like that.
Mm-hmm. There's a good question in the Q&A box too from Eric, and he's asking, what type of outdoor programming do you foresee being the first to get up and running when social distancing mandates are lifted? And I'd love to talk about that a little bit and see if you have anything else to say on it, Cathy, too. I think it's a great question. For me, I can imagine, parts of the country that haven't been as affected by COVID as Seattle has been, where I live, where the threat is already quite low to begin with. And the key being that their staff and their participants come from the local area. The red flags for me are organizations right now, at least, where people have to travel from all over the world or all over the country to come to a central place. The act of traveling there alone, creates new exposures for them. And then they're potentially introducing COVID to a community that doesn't already have it. So there's all kinds of problems happening in that environment. In the case of a local program in a less affected area where you could run a quality program and do a good job with your admissions process and your medical evaluation up front, and also have good in the field practices and policies and the ability to respond if there was signs and symptoms. All the quality program things that Cathy started with, I could really see that happening, more easily for a smaller program than one that's relying on a lot of long distance travel for the staff as well as for the students. I don't know if you have anything you want to add to that, Cathy, but that would be an example for me.
Well, I would add this, and again, we're talking in such general terms, it's hard some ways to relay, what we're thinking, but from my perspective, and I guess I'm also thinking about what I'm doing right now with some of the programs I'm working with that, for example, are anticipating or getting ready to try and open either alternate programming or programming they've done before. And part of what I want to do is make sure that the people that are coming are clearly and fully aware of the additional risks. If they choose to voluntarily come or send their child, that they agree to those and they agree to assume those. And you can imagine what those are, the fact that they could catch COVID there, or the child could bring it home to their family, or and blame that would go to the program. So let's say you feel you can do a program that is responsible at a given time, whether it's in the summer or in the fall or whenever it is, making it clear through documentation, through communication, that here's what's going on. In addition, the risk of catching a contagious disease or a virus is integral and inherent in it with any program operating in the US or overseas. but this has raised it to a new place because it's so global and it's so pervasive. So having that additional communication and information exchange, both from a legal risk management and practical perspective, and that includes the personal responsibilities of the person coming and I'll never remember this little personal protective measures. Is that what PPM?
PPE, personal protective equipment.
But yeah, their personal responsibility in terms of coming there and agreeing that they're going to be a part of the risk management team. They're going to agree to whatever it is you want to do, and that those sorts of things are all very important.
I've answered a few other comments in the chat box, but curious if anyone has more, if they want to raise their hands and ask any questions.
I would just offer one response to how soon is too soon to cancel, I think somebody said. And I would say that it really depends a lot on the structure of your program, where you're going, what perhaps what alternatives might you be able to offer other than canceling? How much money have you paid to suppliers? Can you withhold some of that money and wait? There's so many factors that go into that, and frankly, what your contracts say. All of those things should go into your decision on whether or not you are going to cancel. I think it's not a one-size-fits-all answer. Steve, do you have any thoughts on that?
I have nothing to add to your great points there, other than saying that some organizations have already made the decision to cancel and have announced that. And others are buying some time and waiting to see what unfolds. And others were in a situation where they weren't planning to run in summer anyway. They have a fall and spring program, so they have a little more leeway.
Yeah, and what I was going to say is some programs have just canceled up to a certain point.
Yes.
If they offer programs all year round, for example, they may have canceled through the end of May, and they're trying to decide other programs. Like I know one of Steve's clients that was on his webinar the other day, they've made a point to reach a certain time of the year, and that they're going to, and then they're going to look at reopening if they can. They're working towards that date, and they've made those announcements. So those are all things to consider.
I see a great question in the Q&A box from an anonymous attendee with a very good question. Has the medical community closely compared COVID to other illnesses or diseases that we historically screen for? I'm wondering if there's any possibility of us being able to use the current systems of screening for this new problem. And I would say it's medically too early to know. We don't know how long the incubation stage is for COVID. We don't know how long it can live on different kinds of surfaces. We don't know exactly, there's no vaccine. It's way too early to know. And it's not going to be, we're not going to know for a while. It's, I would guess there won't be a vaccine really broadly available for a year. What kind of antibody testing, antibody tests are really important, and they're trying to develop those now. But the answer is no, it's way too early to know. Part B of your question is, are there current systems of screening that we could use? And I would say when we do know more about COVID-19, a system that could work is open-ended broad questions for all of your participants and a more targeted set of follow-up questions for anyone who fall into a certain category. If someone answers yes to any of the following questions, that could trigger a follow-up questionnaire that's COVID specific, so that you're not wasting your screener's time looking at COVID specific things for hundreds and hundreds of people when there's really only a small group that probably needs those follow-up questions. So that would be a strategy that I see a lot of organizations use, which is, the follow-up questionnaire if triggered by X, Y, and Z, which could also be things like mental health considerations or cardiac issues or whatever the follow-up questionnaire might be.
Good, and I see one, this really feeds right into what Steve was saying about being nimble and being able to pivot on your risk management practices as a reviewer for AEE accreditation programs. I'll be curious about examples of pandemic best practices for crisis management plans, written PNPs. Those are all going to be evolving. I don't really like the word best because best assumes an absolute, but responsible practices, I would say, all of these are going to be feeding in to the new learning. We're all learning right now, including, as I said, I am, Steve is. We're having to think on our feet all the time as we're, just sort of, barraged with questions coming from so many different things as things change almost daily on a federal or state or a global level. So we're all really using our frontal lobe here, and we are going to count on a lot of you to come up with some really creative ways of moving forward with some of those.
A few more questions. Can you see those questions in the Q&A box, Cathy?
I can. I'm looking through them now.
Okay, cool. I'd like to take Chris's question first, which is about the metrics that public health authorities will use to decide when to relax restrictions. And then a follow-up question about public lands that are currently closed and how might those reopen. And hi, Chris, nice to have you on the call today. So I can't predict what the federal government is going to do because they're not necessarily just looking at this through the lens of science and epidemiology. They're also looking at it through the lens of economics and politics, and there's a lot of competing incentives there between what is best from an epidemiological perspective versus what is best for the economy versus this is an election year, so what's going to make a candidate more or less electable? There's a lot of competing things going on federally right now, unfortunately. And if you look at the difference between, the curve of the pandemic in South Korea and the curve of the pandemic in other countries, New Zealand, United States, stuff like that, you see very different stories unfold because of those different political and socioeconomic responses to the pandemic. So it's remarkably some great risk management lessons that come from all this, I'm pretty sure. I do have an article that I read in the New York Times that talked about what would those metrics be if they did agree on useful metrics. What would those be? I don't remember them off the top of my head, but maybe we can bundle together some resources like that and share them out to people as a follow-up to this webinar. So I'll find that article and make sure that that gets shared. The one about public lands is tricky because, again, they are often either state by state or the different subsections of land managers, BLM, Forest Service, National Park Service, et cetera, et cetera. They all could proceed in slightly different ways. Right now, some forests in Washington state are closed, national forests are closed through September, and others are just closed for the time being. So they've made different announcements about different things, and it's part of the patchwork quilt problem of 50 different states and then subsets within those states all making separate decisions about things in the absence of a clear federal guidance on those topics. So I hate to give you such a vague answer, but the answer is that it really depends, place by place. I will bundle up some of those resources and try to share those with folks afterwards.
Great. There's another question I see from Peter Green. Although I suspect most of our organizations can construct logical arguments why we shouldn't refund deposits, for example, if it's in your terms of agreement, should we also not be sensitive to the position that some of our clients are in? Possible job loss, family financial troubles, even if it makes it challenging to our organization. And that is a really good question. I actually had that come from a client who was struggling with what to do. And I think it is a balanced, I definitely would work with your legal counsel, depending on what your terms say and all of that. But what it raises in my mind, would there be a different deal perhaps for some than others? Maybe not, but across the board, I think you still need to look at how are you going to be able to remain viable? Is there a way that you could perhaps refund to some and not to others, or just refund partially, even though it says you would not be providing a refund? Are there ways that you can pivot to address the situation that in your mind feels would be fundamentally more fair or more appropriate in this very unique situation? Maybe it won't be unique in the future, but for us now, as we sit here, this is an extremely unusual, pervasive situation. So that's a very good question and a very important thing to consider.
I'm in the Q&A box here, and there's two. I think we should take this first one because it came in a while ago, and I'd love your thoughts on this one, Cathy, from a legal perspective. The question is, my supervisor may be looking at getting us back into the field sooner rather than later. I'm personally not very comfortable with that. What standing do I have with my employer if they request that I work a program, work in the field, when I don't feel comfortable doing so? So that's a really fascinating question about workplace culture, about worker rights, about employment law. So there's some legal sides of that that I can't address. Cathy may have a view on those or not, but I would generally say that I would answer this question not just about COVID-19. I would say, what is your working relationship with your supervisor? What is the culture like in your workplace that allows the field staff or employees to speak up when they have concerns? Do you have an environment where people are reporting incidents and near misses and trying to learn from them? Or do you have a kind of workplace where you're afraid to bring things like that up because you might get in trouble or you might look bad? In other words, what is the atmosphere of risk management or the culture of risk management like in your workplace? And if you have a really positive, open, learning focused, forward looking kind of culture, then my guess is that this could be a healthy situation where your supervisor's job or the owner's job is to ask these questions and to try to open the organization and keep it running and keep it viable. And your job is to speak up and raise your concerns and to use the tools and systems that are in place to do so. So this could be a very good story, or it could be a situation where maybe that's not the right place for you to work. And maybe that's not the culture and the direction of that organization may not be consistent with your personal values or the kind of place where you want to work. So I'll just be blunt about that. And that's my way of answering that question. It's not so much a question about COVID as I think it's a question about the workplace environment.
Well, and I would agree with Steve. I don't specialize in employment law, but I really think it gets down to something super important on every level for your staff. I mean, to me, I think of a staff handbook that is written in such a way that it pens your staff into certain positions that are impossible for them to meet. That they are going to assure the safety of your participants at all times, or something like that, and provisions in there that make them feel like they don't have a voice, and they just are gonna, they're gonna do their own thing. And in this case, if you have good communication and people feel like they can talk about what their concerns are, perhaps you can resolve that on the most fundamental level of having a group meetings together to talk about what plans you have to endeavor to put them in a healthy place as you move forward. Who have you talked to? Have you talked and communicated with your Department of Public Health and understand what they're recommending as things begin to open up for the protection of your staff as well as your participants? And they're the people you hopefully you value, and they have affinity to your organization and they want to be there, but they should have a voice and have the ability to raise those concerns. And of course, if you need to talk with your legal counsel about that's another one. I definitely think you want to be in touch with someone who's familiar with those employee issues, and that's a whole nother really ball of wax that we haven't touched on too much in this conversation, but an important one.
Debbie has a question about mentoring younger staff who are responsible for safety and for, responsible for good hygiene and habits and practices, but may themselves not really have an inherent fear of COVID-19, or they just being younger, they just may be less vigilant. And my two thoughts on that question are, until someone turns 24, which is the average age at which our prefrontal cortex is really fully developed, you're in many ways still an adolescent. And what that means is that the more primitive part of your brain, your amygdala, is going to be driving the bus and making a lot more decisions. And those decisions are heavily influenced by your peers and by desire to try new things and for the need for approval and lots of things like that. So one of the best ways to counteract the extent to which your amygdala is driving the bus of your decision making is adult presence and supervision. I know it might be odd to think of a 23-year-old as needing adult supervision, but until people turn 24 or older, just simply having more of an adult presence can really help them make better choices, be more self-aware, operate with their prefrontal cortex and not their amygdala. And so the answer to this one is just more staff allocated to be roving around, paying attention, supervising, adding value to their ability to make good choices. So that's one answer. And some of your program models are group size limits or whatever, that may not be possible. And in that case, I would say that people can be solutions to our safety issues, not just the causes of the problems. And finding a way to really empower your young leaders with a sense of responsibility and tapping into maybe scenario-based training with them in advance to really help them practice, what does this good habit look like? What is it that we really want and need to see from you? And to create that peer-to-peer responsibility where them and their co-instructor are both holding each other accountable to the new expectations or protocols, or whatever it is that you might have. So to see them not as problems, but to see them as solutions to your problems.
Great point, Steve. Really good.
Well, any others, Sherry, that you think we should try to address?
I think we've taken care of a lot of them. If you have further questions, Steve and Cathy have both made their contact information available to everyone. And they are open and willing to answer questions, which is amazing. Thank you so much. We really appreciate AE, appreciate you doing this webinar and being here and supporting our community during this time. If anyone needs further information, you can go to our website, www.ae.org. Lots of resources in our resource library, including some of Steve's other webinars and information. Just everybody stay safe and keep your hands clean.
Good luck to everyone, and thanks to AE for this great opportunity to meet with you all. And really hope that we can all move through this together and learn some good lessons along the way and just build more resilience through this experience for the future. And Cathy, what a pleasure to have a chance to do this talk with you. Thanks so much.
You as well, Steve, and thanks again to AEE and to all of you for spending the time to listen, and we really value your input. It helps us as well on the ground. So thank you so much.
Good luck, everyone.
Bye-bye.
Thank you so much.